This is Kim Newlove, host of the Pharmacist Voice podcast, where I share my journey from pharmacist to voice actor and interview a variety of people who use their voices to advocate for something, educate in some way, or entertain so that you can be inspired to use your voice too. This is episode 123, and you can find the show notes with links to anything mentioned today on my website, thepharmacistvoice.com. You can also find my medical narration demo and a link to my online course, Pronounce Drug Names Like a Pro, on my website. That website again is thepharmacistvoice.com. Today's episode is an interview with Dr. Renu Lal. Renu is a pharmacist and an officer in the Commissioned Corps of the United States Public Health Service, otherwise known as the USPHS, a uniformed service committed to protecting, promoting, and advancing the health and safety of the nation. She's a team lead in the Division of Drug Information, or DDI, within the Food and Drug Administration Center for Drug Evaluation and Research Office of Communications. Along with directly communicating with the public, the division is also responsible for many initiatives and outreach programs, such as the CDER Small Business and Industry Assistance, or SBIA program, FDA Drug Info Rounds videos, drug safety podcasts, Drug Information Soundcast in Clinical Oncology, also known as D.I.S.C.O, webinars for healthcare professionals and students, and more. I invited Renu to be on the podcast to share her unique career path and how she uses her voice as a pharmacist. Two things you will learn about in this episode are opportunities for pharmacists in the public health service and free resources for healthcare professionals. If you like free resources, or you're a pharmacist who's looking to do something different, you're going to like this interview. Without further ado, here's my conversation with Dr. Renu Lal. Hi, Renu. Welcome to the Pharmacist Voice podcast. How are you?
I'm good, Kim. How are you?
I'm good. Renu, I invited you to be on the podcast today to share how you use your voice. But first, I'm curious, how did you get from pharmacy school to where you are today? Was becoming an officer in the Commissioned Corps of the U.S. Public Health Service part of the plan when you entered pharmacy school?
So I actually had no plan. I graduated from the University of Connecticut, or UConn. But when I went into school, I actually didn't know anything about pharmacy. I just knew that I maybe wanted to go into the medical field and help people. I always liked science. I liked biology and chemistry. And so I just kind of, I don't remember what my degree was back then that I declared. But as I was taking my first and second year standard science classes, I came to learn about the pharmacy school and I met people. And I really just was fascinated by how medications worked. I wanted to learn, how do these drugs work? Just like over-the-counter drugs in the drugstore. And it just fascinated me. So it wasn't really becoming a pharmacist that drew me in. It was the knowledge that I would gain from pharmacy school. And then even after pharmacy school, I didn't really think, what was I going to do with that degree? Was I going to go on and get another medical degree, or was I going to get my PharmD? I hadn't really planned that. I was pretty much just see how it goes and just learn along the way. And actually, the year that I graduated from UConn was the last year, I believe, that a Bachelor of Science in Pharmacy was being offered. They were not offering the Doctor of Pharmacy or the PharmD back then. That's dating me. But besides that, the year after I graduated, they started the 6-year PharmD program. So I graduated in 98 with a Bachelor of Science in Pharmacy. And from there, I went straight on to get my 2-year post-baccalaureate PharmD from the Medical University of South Carolina in Charleston. And then I guess, throughout both undergrad and PharmD school, I had worked both retail and hospital. And when I finished my PharmD, I still honestly did not know what I wanted to do with it. I know it sounds crazy because it seems like all the students I come across in precept now are just so, they have their career path lined up. They know what they want to do. They know I need to do my residency, my fellowship, and this is where I want to end up. But I
Wow.
honestly did not know. And I think that's okay to not know and just make it up as you go along. I always envied those people that knew exactly, what they wanted to be when they grew up. But for me, it was more just learning and seeing where my experiences led me. So after that, after I finished my PharmD, I ended up getting a job as a floater pharmacist at Eckerd Drug, which I don't even think exists anymore. They were bought out. But I worked a lot of overtime, and I would get called every morning. I don't know if you were ever a floater, but I'd get called every morning with a schedule of where I was needed. And I would show up to a pharmacy with a line of customers and a stack of prescriptions to catch up on, having no idea what happened the day before, the night before. So I was in some really interesting situations. But, I knew that was not what I wanted to do. That was probably a really bad exposure to retail because it was a floater. And, I have a lot of respect for people that do that. But, it was grueling. So after about a year and a half of that, I was pretty much done.
Wow, you lasted a year and a half. Way to go. You are
Yes.
tough.
Well, I made a lot of money.
Yeah, that too.
Overtime as a floater right out of pharmacy school wasn't really a bad deal. So I guess going on, let's see, after that, you know, that's when I entered the public health service. And again, I think my only exposure to PHS before that was when I was at UConn in undergrad. We had a pharmacist come in and talk to us about public health service, mostly Indian Health Service, his job there. And, I didn't really consider that as a career. We had people come in and talk to us all the time. But after I joined, I did, recall that.
Mm.
And so what happened was at UConn, I had finished my classes a semester early, and I was really looking for a unique experience to fill the rest of my time. So after just kind of poking around and asking around, one of my professors contacted a former student of his, and he put me in touch with her. And she was just absolutely amazing. She turned out to be my mentor for just years to come. Anyway, she offered me a 4-month rotation with a psychiatric hospital in Southeast DC called St. Elizabeth's Hospital. And this facility is just amazing. I don't know if it's around anymore, or if there are officers there, but it really opened my eyes to the world of mental illness. I had not had much exposure before this. Just a little history on St. Elizabeth's, just because, I think that's what really drew me into becoming an officer. It was established back in the 1800s, and it used to be called the Government Hospital for the Insane. And it was used by the Army and the Navy back in the Civil War. So it goes way back in history. And it used to be like a fully functioning community where the patients would pretty much, there would be, different jobs for them to do. So just reading about that and learning about it while I was there just was really amazing. Along with working as a staff pharmacist, I used to interact with patients quite a bit as well. I did a lot of counseling and medication chart reviews, and then I did writing and other projects.
Wow. So that was your introduction to the public health service. My
Yeah.
introduction to the public health service was actually as a student in pharmacy school. I had to do an 8-week rotation at the Federal Bureau of Prisons in Milan, Michigan. It's a federal correctional institution for men. And as a woman going into there and having a pharmacist who was a female, that was an amazing opportunity because she was very creative and resourceful, and the formulary was really small. So I'm sure that you going from a floater pharmacist in a chain drugstore to working in a different setting for the public health service must have been very eye opening. What was that like?
Yeah, for sure. This wasn't just your standard run of the mill hospital. This was, it was a very different place. So it was definitely eye-opening. But it's interesting that were you a student, like a pharmacy student, or you didn't join as a co-step, did you?
I did not join as a co-step. I was never an officer in the public health service. It's kind of complicated how I came there, but I'll boil it down to this. Back when I went to pharmacy school, the BS Pharm was the only degree required. So I am a 5-year BSP. You are also, correct?
Yay.
Yay. Yeah. Class of 2001, University of Toledo, never got my PharmD. And back in the day, we only had one semester of rotations. And those rotations were split into 8 weeks and 8 weeks, total of 16 weeks, like a normal semester, right? 8 weeks of my rotation was with Walgreens doing a management rotation because, like you, I had hospital and retail experience. So the pharmacy school thought, well, let's put her in a different kind of rotation. So I went to Walgreens and I did a management rotation with one of the pharmacist supervisors for the district, Southeast Michigan. And I was in Toledo. Southeastern Michigan is like a hop, skip, and a jump away. And then for the other 8 weeks, I ended up at the Federal Bureau of Prisons because, again, I had retail experience, I had hospital experience, and they thought, what else can we throw at her? Let's send her to prison. So they ended up sending me to the Federal Bureau of Prisons. And I got to tell you, I loved it. It's what I call kind of an underserved population. They can't exactly choose where they want to go get their prescriptions filled, right? There's one pharmacy, there's one medical unit. I met all kinds of people. We had doctors, physician's assistants, a pharmacist, an x-ray tech, a dentist. So if you can imagine this small medical facility within a prison, I was behind bars, not the inmates. I was behind bars. And I was, dispensing medications, counseling through the window, and learning from this wonderful pharmacist who happened to be a uniformed officer in the public health service. So that is how I got this introduction to the public health service. And I myself wanted to go into the Navy when I graduated. I actually went to Washington, D.C. and interviewed at the National Naval Medical Center or Bethesda Naval Hospital. I think it goes by a couple different names. And when I got there, the interview went great. They said they wanted me. But as I went through the application process, I realized that my asthma is a disqualifying condition.
Oh,
Asthma is a
wow.
disqualifying condition for Department of Defense service. So I ended up being a federal volunteer for the U.S. Department of Justice inside the Federal Bureau of Prisons, working for the Public Health Service. I know it's kind of like convoluted, but that's my story, and I'm sticking to it.
That's really interesting. There's just so many different, it just amazes me as I talk to pharmacists, just the different paths that they've taken. And, I guess that's what we're talking about here today. But I actually, when I joined, I was a junior co-step. So that's kind of like an internship. We have student opportunities in the commission core, the core, I'll call it. So it's basically like an intern with PHS. It was my last semester in pharmacy school for my BS.
Oh, okay. Gotcha.
You can, join as a co-step when you're a student. So I was basically an intern. It was 4 months, it's kind of like an extended rotation. You do have to fill out a lot of paperwork, but it's an amazing opportunity. There's also something called a senior co-step. So there's some different student opportunities with PHS, and you can, if people are interested, they can read about that on our website at usphs.gov. And just, did we talk about PHS and what it is exactly? I don't know if we even talked about that for the audience.
No, but there's no time like the present. What is the Public Health Service? Let's hear all about it.
The Public Health Service is one of 8 uniformed services, and it is the only one that's dedicated solely to protecting and advancing America's public health. So in addition to our day-to-day jobs, we as officers are often the first in line to defend our nation's public health threats, including deploying for public emergencies, and I've deployed many times, and providing essential healthcare to the underserved and vulnerable populations. So there's just so many different opportunities with the public health service. You can, it used to, I think, be called pharmacy's best kept secret, but that's not really true anymore with PHS just playing such a prominent role in the COVID response. It's not really a secret anymore. But what draws people in most is the mission to promote, protect, and advance public health and the safety of the nation. And the opportunity to serve the underserved and vulnerable communities or to advance practice, policy, or research. So we're led by the Surgeon General of the United States, and our origins actually trace back to more than 200 years to when the US Marine Corps Hospital Service was containing the spread of disease from sailors returning from foreign ports and providing care for new immigrants. So it's a very old service. And as a PHS officer, you can serve in so many different HHS agencies, Department of Health and Human Services. There's the Indian Health Service, the Bureau of Prisons, which you had exposure to. There's the NIH, CDC, FDA, EPA, SAMHSA, which is mental health. And there's just so many more. So there's a lot of different opportunities, and they actually encourage mobility, moving to different agencies and different positions. And being a PHS officer actually makes it easier to transfer between agencies if you do so. And that's kind of when we get into my story, what I did. And then students can join like I did. We have two programs. We have a junior co-step program and a senior co-step program. So the junior co-step program is more like an internship that can last anywhere, I think it's between 30 and 120 days, but the students are actually paid. So I got paid when I was a co-step, which was great. And you receive health benefits. You get housing and travel allowances. Senior co-step is the same, but also a little different because students receive the same benefits. They're given a rank, the rank of ensign, I think, and they're expected to become an officer upon graduation. So it's give and take. And you're expected, I believe, to complete at least twice the amount of time that you served as a senior co-step. So you would have to give that much time back as an officer. And, just more about PHS, the benefits are actually really great. We are on the military pay scale. So we get 30 days of paid leave per year, which is a lot. I usually can't use all of that. We also have non-taxable housing and subsistence allowances. So not all your set salary is taxable, which is also very beneficial. And then the medical, dental, and prescriptions are all free of charge. The retirement plan is excellent. And then there's also a GI Bill to put towards your education or your kids' education. So, like I said, if you're interested, www.usphs.gov, and it's definitely worth exploring as a student or anywhere in your career. You can join later in your career. I think you have to be under 44 years of age. Don't quote me on that. But you can definitely join later on. You don't have to be right out of school.
Now, I have a question for you. I kind of sensed a gap in there. You were a co-step when you were a student, but I heard you say that you went out for a year and a half and became a floater. Can you tell me a little bit about that? Was the co-step during your PharmD rotations, or was it during your BSP rotations?
It was my bachelor's, my BS rotations. It was the end of my bachelor's. And then I graduated. And then I went straight to get my PharmD. And then I became a floater. And then after that, I rejoined as an officer. So that's when I realized after being a floater, I want to go back and work for St. Elizabeth's. That's what I want to do. That time really made me realize that. And since I had already completed my time as a junior co-step and I was already kind of in the PHS system, it was really easy for me to rejoin. Usually, if you're joining as a federal employee, it can take a really long time, but it was actually pretty smooth. And so I rejoined at St. Elizabeth's since I was already there as a co-step. And I worked there for about 2 years. And, working there, I met other PHS officers, both within St. Elizabeth's and in other agencies. So in some of my training, I met some other officers that I actually work for right now to this day, and I ended up transferring to the Food and Drug Administration. So I ended up joining the Division of Drug Information in FDA's Center for Drug Evaluation Research, or CDER, which is where I work today, many years later, still as a PHS officer. So I do want to say that my path was probably different than most PHS officers in that I did leave a few years. I left the Corps for a few years to work for the pharmaceutical industry. I wanted to see kind of what life was like on the other side. And I was moving cross country because I got married, and I thought, well, it's a good opportunity to just, take a break and see what else is out there for me. So I worked at Genentech in South San Francisco for 2 years. I was on a clinical regulatory team, and I provided input to the team from a strategy and filing perspective. And it was very different. It was very interesting. I got to see the other side of FDA, the people that we serve as we serve the industry as well as the public. So it was really eye-opening, and I enjoyed it. It was just surrounded by brilliant people at Genentech, honestly. And then after my daughter was born, we decided to move back to the East Coast to be closer to our parents and family. And so I rejoined the Division of Drug Information, or DDI.
That all sounds like a great story. Definitely a twisty, windy path to get from, pharmacy school in Connecticut to working for the Division of Drug Information as a uniformed officer in North Carolina. So you've been kind of around a little bit, and that's pretty cool. Now, I've got to ask, how many years of service do you have in with the Public Health Service at this point?
I think I have over 10. I should probably know this off the top of my head. I have, I believe it's a little over 10, maybe 10 or 11 years total. I had about 6 years before I left, and then I rejoined in 2017. So that sounds right.
Well, congratulations on your 10 years of service. And I've got to ask, how much longer do you think you'll be with them? I hear that retirement's at 20 years. Is that true?
You can retire at 20 years and get your benefits, or you can stay until 30 years. So, we'll see what it has in store.
Well, you're halfway there.
Yes.
Renu, let's talk a little bit about how you use your voice. Now, one of the things I heard you talk about when you explained what the Public Health Service does is protect the health of the nation. To me, part of that is medication safety. Specifically, in your current role with the Division of Drug Information with the Food and Drug Administration's Center for Drug Evaluation and Research, Office of Communications, you are in a position to use your voice to share resources that I think pharmacists, pharmacy students, pharmacy technicians, and other healthcare professionals should know about. So, can you tell me about some of the resources?
Yes. So let me start by telling you about what we do in DDI, that, to kind of segue into the resources so you have some background.
Okay.
We do so much to communicate important drug information to the public. DDI is the focal point of inquiries for CDER, so Center for Drug Evaluation and Research. The inquiries that come in, many of them are triaged to us. So, and we get inquiries directly from the public as well through email and phone. We have a staff of, I believe, over 40 pharmacists now, pharmacists and other healthcare professionals and non-healthcare professionals, but mostly pharmacists. And we have teams that answer phones and emails from the public. We have inquiries from consumers, healthcare professionals, pharmaceutical industry, consultants, lawyers, you name it, and they contact us. Anyone can contact us. And we get all sorts of questions, a lot of drug safety, a lot of questions from the industry, the pharmaceutical industry. And as you can imagine, it's been extra busy since the start of COVID. We've had just so many questions, so many requests, and just so much going on. We also handle emergency IND, or expanded access requests, which you may know of as compassionate use, when a physician wants to use an unapproved drug for a patient that may have a life-threatening condition where there's no other suitable therapy, and they want access to this unapproved product. So they contact us. They call us, they email us, and we speak directly to the healthcare professional requesting it. We collect the pertinent information. We communicate directly with the Office of New Drugs here in CDER. And in some cases, we even authorize the request so that the physician can obtain and use the products as soon as possible. And with COVID, the number of inquiries have just shot up, especially now, with people that are immunocompromised and people that have no other option. I'm also part of an after hours team where we do this 24/7, and we're on call like once a month or 2 months. And again, it's been extremely busy for the past 2 years during the pandemic, but also extremely fulfilling to be able to help people that really don't have any other options. So that's one area where I really feel like I make an impact and I interact with the public and help them. And I'm also part of the Small Business and Industry Assistance, or SBIA, program within DDI. And within this program, we engage with the pharmaceutical industry. We provide free conferences and webinars, which are all recorded and now posted on YouTube. We have web content and so many more resources. We actually just held a 2-day virtual pharmaceutical quality conference earlier this week. And again, we post all the recordings on the SBIA playlist on FDA's YouTube channel, and that's new this year. So, we have a two-way street with the public, both responding to inquiries and conducting a lot of outreach using our voice. I have been with SBIA since the start, when all we really did was answer inquiries. And it's just amazing to see how much, I guess, we've used our voice and how much we've grown over the years and how much outreach and education we're now able to offer to the pharmaceutical industry so that they can submit these applications, complete applications for drug products for approval. And other than SBIA, I mean, I'm involved heavily in that, but we have so many other ways that we reach out to the public to provide information and to use our voice as pharmacists to be heard. We have a very active social media team to push out messages through listserv or email, Facebook, Twitter, LinkedIn, and I'm sure you can relate to that since you do the same with your podcasts. We coordinate and we record podcasts and recordings as well for the public to provide information about new drug approvals, safety information, new guidances, and just so many different aspects. We get out there and we use everything that we can to do this outreach.
Renu, I'd love for you to talk a little bit about the FDA Drug Safety Podcast and the D.I.S.C.O podcast and the FDA Drug Info Rounds video series.
So Drug Info Rounds videos are educational videos featuring our very own DDI pharmacists, and they are meant for healthcare professionals. They address topics relating to drug products and FDA actions, and they're really a unique outlet to reach healthcare professionals so that they can stay up to date with the latest information. And there's really a wide variety of topics. Some topics that we have videos on include medication guides, expanded access, just the definition of a drug, which is more ambiguous than you may think, REMS at FDA, so safety and REMS, MedWatch tips and tools. There's really a wide variety, which you can find by visiting the FDA Drug Info Rounds webpage. And then we also, like you mentioned, we reach out to the public via podcasts. And right now, DDI produces 3 podcasts. We have the SBIA Chronicles podcasts, which are meant to highlight trending regulatory topics for the pharmaceutical industry, giving them a synopsis of new and many times complicated issues, just breaking it down. These podcasts accompany our SBIA Chronicles newsletter, which I write in conjunction with the subject matter experts for the different topics. And we post the newsletter and podcast to our website and social media. And the website is www.fda.gov/CDER SBIA and /CDER SBIA Learn. And we also send it out to our listserv subscribers. And then, so that's industry focused. We have 2 podcasts that we produce that are more healthcare professional focused. We have the drug safety podcast, which we use to discuss emerging safety information about drugs. Recently, we recorded a podcast about the warnings of increased adverse events with JAK inhibitors that treat certain inflammatory conditions. We also did one on statins this summer when FDA requested removing the contraindication against using statins in pregnancy. We did one in the spring about the warning of side effects from vapors from alcohol-based hand sanitizers. So they're very timely topics, and they're geared towards healthcare professionals. They're only 3 to 4 minutes long, so they don't take a very long time to listen to. And they're accompanied by, the transcript, or if there's an article or something to go along with it. So it's for those people who don't necessarily have time to read. And then we also have the D.I.S.C.O podcasts, the Drug Information Soundcast in Clinical Oncology, and we work with the Oncology Center for Excellence to produce those. It's a podcast series about new product approvals and emerging safety information for cancer treatments. And these are also very short, anywhere from 3 to 5 minutes, but they provide so much information and bring information to light that may otherwise have been missed.
Yes, they're on very serious topics and timely topics too, which you've mentioned. But I've got to say, the D.I.S.C.O podcast has a little sense of humor because the music that is played at the beginning is disco music, right?
I love it. It makes you want to dance, right?
Yeah, it also makes you feel like even though this is going to be a serious topic, we've got a sense of humor. We're going to get you through this. Just listen to this. We'll get you the info. I like it.
And if you want to know where to find the podcast, I believe you're linking it in the blurb that goes on your webpage. But both the drug safety and the D.I.S.C.O podcast have RSS feeds, and we post to iTunes, Google Podcasts, and Spotify. And the podcasts are also streamed on ReachMD's internet radio channel. And like I said, we promote on Twitter and LinkedIn. So, these are really an easy way to stay in touch with these issues that you might otherwise miss. And so we encourage healthcare professionals and pharmacists to subscribe and to tune in. There's just so much value in using different types of methods, as you know, to communicate with the public, which is exactly what you do, because everyone has their own way of staying up to date, and nobody has time anymore for anything. So it's just so valuable. And we're always looking for new ways in our division to use our voice and, to grow. And so every year we come up with new things to expand.
Well, you're doing great. You're definitely reaching my ears. And there's one other thing that I'd like you to share about, and that's the webinars that offer CE, the webinars for healthcare professionals and students. What can you tell me about those?
So we have a webinars team, and we put on these drug information webinars every month, again, on just various topics. They're just great topics for pharmacists to stay up to date, and they offer CE credit. We also have home CE credit. If you go to our DDI webinars webpage, you can do your CEs at home and get credit if you can't join for a particular live webinar. There are other options. So there's just so much training that we offer. And like I said, we offer them in so many different formats because we know everybody's different.
That's right. That's good to keep in mind. Some people learn in different ways. They're more visually oriented, so they like the videos. Webinars combine the video and audio. The podcasts are audio only. So that's great that you're reaching a lot of people. And pharmacists out there should check out some of these resources because there's a lot of free stuff out there, free info. And it's great for pharmacists to keep up with this information. Back to the webinars that offer CE, is that free CE or is that paid?
It's free. Everything we offer is free.
You can't beat that, right?
Right. Yeah, I feel like it's so much easier to get CE these days in our virtual world. And FDA is definitely one of the places you should go for your CE. We also have a website called CDER Learn. And that website is kind of like a portal for all of our CE activities. So you can go there and find different topics. Some offer CE, some don't, but our webinars and podcasts are also linked directly through there. And the website for that is www.fda.gov/CDER LEARN.
Thank you. Those are a lot of great resources that pharmacists, pharmacy students, pharmacy technicians, and other healthcare professionals should know about. Free information and from a reliable source is great. That's golden. Renu, do you have any advice for currently practicing pharmacists or newly graduated pharmacists?
Yes. So I would say do and learn what interests you, and the rest will fall into place. As you can tell from my story, I did not really plan anything. It all kind of came and fell into place as I explored my different interests. There's just so many different opportunities for pharmacists and so many different outlets to help people. Throughout pharmacy school, I always heard that pharmacy is a small community. And through my experiences and just my career path, I can definitely vouch for that. You really never know who you'll meet. And one day you may even be working with them or for them.
Great advice. Thank you very much for being on the Pharmacist Voice podcast. Have a great weekend.
Thank you. You too.
Thanks. I'd like to share a couple of final thoughts with you. First, I love Renu's advice at the end. Do and learn what interests you, and the rest will fall into place. That really is great advice. I became interested in a number of areas while I was working as a student and then later on when I became a pharmacist. My interests expanded when I volunteered later in my career. I've been a pharmacist for more than 20 years. I became interested in still more areas during my time as a stay-at-home parent. My inspiration has come from all sorts of places, and yours can too. Keep your eyes open for what interests you, and like Renu said, the rest will fall into place. My final thought is about the resources that Renu mentioned. Look for links to those resources in the show notes. They're at thepharmacistvoice.com. She mentioned podcasts, videos, webinars, and the Public Health Service website. There's a lot of resources mentioned in this episode. Again, look for links to those resources in the show notes at thepharmacistvoice.com. Thank you for listening to episode 123 of the Pharmacist Voice podcast. If you liked this episode, please share it with a friend. And subscribe to or follow the Pharmacist Voice podcast on your favorite podcast player to get each new episode delivered to your smartphone every time a new episode comes out. Thank you again for listening.